Hello, welcome back to our episode. We really hope that you enjoyed the last one, and we are very thankful that you are back to the today's episode. So it's still me, Lisa, and today I'm only with Confidence, but I'm super happy that we are here again. So hi, Confidence, nice to have you.
Likewise, thanks for having me.
We will discuss a very important topic. Because of that, I'm super excited,
I love it.
Yeah, because of that, we will discuss some health myths, and I think this is quite an important topic because they are super present in the internet and on social media. I don't think that every patient fully believes them, but at least partially.
That sounds really exciting, especially because I'm not a medical professional, so I can maybe give the perspective of a layman, so to speak.
I will read it out loud, and then you give me your first impression. Is it true or not? Is it a myth or is it the truth? Okay.
Okay.
There is a claim that says you need to drink 8 glasses of water a day. What do you think?
Okay, so this one, I think I know the answer, at least coming from from a fitness background, a health adjacent wellness, I should say. I think generally speaking, on average, maybe it's true, even though I know that it differs men versus women. It depends on your body weight. It depends on your the muscle mass, if I'm not mistaken. It also depends on the weather, right? So how dehydrated you are. So I don't know that it's false, but I think you need to drink enough so that your tea is clear and not yellow. At least that's
Nice.
yeah. Is that correct?
I think more or less, but you know what? I expected you. So if I were talking to an engineer, so they would ask me, it depends on the size of the glass,
Yeah. Fair enough.
No, I think you're totally right. I mean, it's not like totally true. So it's not like you have to drink 8 glasses of water. I think this, as you said, it depends on medical conditions as well. So also like, do you have heart failure or not? Then it's very important to restrict also the drinking amount. But you are totally right. I think it's, in this case, we can say it's a myth because it's like good to drink enough. It depends on the condition, on the weather as well. And I think it's good to look at the urine if it's clear or not.
Nice. So many variables at play. Cool.
Yeah, you did it. Next one. I'm not even able to do that, but maybe you cracking your knuckles causes arthritis.
I think I've heard this one before. I've heard this actually since I was a child, so I think it's true.
Rethink it.
Okay, I guess it's not true.
One more chance. I think no, it's not true actually. So
Okay.
also if you're like breaking your arm and then you cracking your arm, then it's a bad sign because the arm is probably broken, But like the joints, it's not a problem. Shall I explain you where this sounds come from actually?
Yeah.
So you have to imagine every knuckle as a joint. There's a joint surface, so from 2 bones, so to say, and in between that is the joint space. So it's a little spacing, but 2 bones, it's not good if they're just very close to each other. So in this joint space is fluid. And when the space is stretched apart, so to say, a vacuum is created, and this causes gases dissolved in the fluid.
Yeah.
And those bubbles produces this cracking sound. So it's not causing arthritis.
Okay.
And I mean, it's a myth that it's causing arthritis.
I did not know that. I had a music teacher in the 4th grade in Texas who she had arthritis. I think she did, and she started wearing actually, how do you say, like a hand brace? I think that's what it's called, maybe. And I don't know if my memory is deceiving me, but I have the feeling that I remember she said that because she always cracked her knuckles. So I think this is where like I imbibed this idea. So interesting. I should reach out to her.
She had really some health problems there.
Yeah.
Because it has the sound, but I think it's not like the average, so to say.
Yeah.
But maybe let's find her for the next episode.
Yeah.
Let's do it this way. Next one. Sugar makes kids hyperactive. Not only kids, but also maybe us. What do you think?
Okay, I think maybe I'm cheating on these ones. The ones that are more wellness adjacent, right? Like health overlapping wellness, maybe. So I think yes, right? Because I don't know the logic, but I'm pretty sure it's yes. Is it
I think
yes?
you know. I think when I tell it you now, you know that logic. So, and technically, it's a myth because like sugar itself is not causing hyperaction as a condition, so to say, or
Mm-hmm.
yeah. But what is true? I mean, sugar gives you energy, so
Mm-hmm.
your body energy.
Mm-hmm.
So I think what is true in this case is that if you eat something, in general,
Mm-hmm.
also sugar, it gives you more energy, and maybe kids are then more energizing and waking up and doing stuff. Next one is heart diseases kills more women than all cancers combined.
Huh. Okay.
Yeah, this is a tricky one.
Is that an easy one you said?
No, it's a tricky one, I
Okay,
think.
yeah, I have no idea. I almost don't want to guess because I have no context, but I'm going to say no, that's not true.
Heart diseases are a very common cause of death, so
Mm-hmm.
to say, and it's
Mm-hmm.
more common than cancer in the whole world, I would say, as well.
Mm-hmm. Mm-hmm.
And in women, especially, those, for example, heart attacks are very atypically and also silent. So if not, it doesn't apply for all again in the world for all men and women. But if you as a man have an heart attack, you will probably feel the common symptoms like chest pain and so on. But in
Mm-hmm.
many women, it is silent actually, or they have back pain, for example, or
Okay.
stomach ache.
Uh-huh.
And they are misdiagnosed very often.
So it's not that women are disproportionately affected by heart disease, it's more that it's easily recognizable in men. And is it also plausible to say that because most testings or like test studies have been run with men, right? So it's easy to, okay, interesting. It was a big topic in fitness also, like a lot of like topics related to like dieting or like specific diet or like even exercise styles. And the whole idea, I think Stacy Sims, who's kind of like a prominent figure in this space, is always using the term like women are not small men, right? So like women's bodies
You know
are
where it comes from?
where
From pediatricians. So we always
okay,
kids, there are no small humans.
interesting.
So,
Okay.
yeah.
Yeah,
Okay. So women are not what small men.
small men, right? And ever since I heard this, it really resonated and it changed my perspective. Yeah.
Last claim, which is feed a cold, starve a fever.
Feed a cold, starve a fever. Okay, first of all,
Exactly what I said.
sorry, I'm sorry.
They're just killing us, guys.
I was like, is this a German term?
No, this is my accent, my German accent.
No, it's good. Feed a cold, starve a fever. If I think about this critically, I've never heard that phrase before, but it sounds kind of true. Like, I guess like when you have a cold, your immune system is suppressed, right? So you need energy. I have no logical explanation for the starve a fever one, but yeah.
Bullshit.
Okay.
No, you're totally right, Joe. So if you're sick, you need energy. So in each case, so I mean, also combines with other conditions. If you have other conditions, maybe there are individual situations. So me as a doctor, I have to say it like that, like carefully, you know.
Yeah.
But the claim is a myth, actually. So it's not true.
Interesting. That was fun.
With that, maybe let's start the discussion about health myths or health claim myths in general. I mean, they are so present. Why? Tell me why. You as a chief product officer, tell me why they spread so well and like real advice, real medical, true advice not.
Yeah. Okay, so I can answer the first part, maybe. I don't know about the second part, like while real medical advice maybe doesn't travel as well. I think generally speaking, news that's a bit more spicy, I can't think of a more proper way of saying that, maybe carries faster, carries better. Like if something sounds really interesting, like cracking your knuckles, like gives you arthritis, you know, it seems it's such an interesting to say, right? So that it carries over really well, and information spreads when it's maybe negative or seemingly negative. Maybe another thing is some of these things, right, is all about like data, right? So like different population sizes. For something to be like really, really true, there has to be the scientific method of like proving it or like disproving it, right? So maybe this happens in certain population, and then it's word of mouth carryover. So like from mother to child and generation after that. So maybe this is how like this this myths carry. And if something happens for me, I think especially like in the past, people would have thought, okay, then this is going to be the case for someone else, right? So if I have this kind of disease and I did something, so like more of a correlation or the causation, then it translates to someone else, and then I tell someone else, and then the person thinks maybe that's true, and then carries over. I have no idea.
Maybe also the mechanism of feeling heard, feeling understood. So a doctor sometimes doesn't understand you, or you have the
Mm-hmm.
feeling that it's the
Mm-hmm.
case. Maybe in
Mm-hmm.
this, do you think also this is a psychological mechanism behind, so that you feel heard because many people experienced it and you feel finally belonging to a group
Yes.
of people?
Exactly, 100%. I think also maybe, I mean, people have, I have this personal complaints with like with the doctors in general. I know that you're a doctor, so interesting to talk to you about this. But sometimes I think because doctors are like medical professionals, they have to be very cautious of what they say. It sometimes feel like I know my body and I know what I'm feeling. And sometimes when you express that, or maybe when a patient expresses that to the doctor, they're only thinking in terms of this is proven, this is disproven with like large sample size and, you know, statistically significant, whatever. So maybe that's why real medical news doesn't carry as well, because everything is so individualized, right? So like every experience is so individualized. Even when we prove or disprove something, there's going to be exceptions to the rules. There's always, yeah.
You think like the human component is missing in
Yeah.
the patient's relationship,
Yeah,
maybe? So
exactly.
what about like a true medical statement?
Mm-hmm.
Let's try to put it into social media words. So would
Mm-hmm.
it work maybe?
Mm-hmm.
Would
Mm-hmm.
it work?
Mm-hmm. Mm-hmm.
I don't know.
I think it would. I think this is also like the what's going to be interesting, or like is interesting about digital health apps. I think this was the case in many ways for like wellness products or like adjacent products or like wearables and fitness trackers, et cetera. And many of them are kind of going into this health arena now. But they, I think, kind of like started this conversation of like carrying real science-backed claims and putting it out on the market. And I think it will resonate. Like, for example, think about the popularity of like the Andrew Hubermans and Stacey Sims of the world. And these people are really carrying over proper medical advice, and people are loving it, like understanding it from a scientific context. So I think I think it will carry over. I think it's just we're at the onset of this kind of true medical advice and information spread.
And do you think like the current platforms are also designed to spread those false information very fastly?
Yeah.
And if so, would we need to adapt those platforms to spread correct infos fastly?
Yes.
Is it like that?
100%. Yeah, I mean, this goes back to what I talked about in the last episode, different context, but I think it still carries over. Regulation is so important. Social media, I mean, I'm all for freedom of speech.
Let's
But
do
I
it.
think
Let's do
I,
it.
I I strongly think that, for example, if you're not a doctor or a medical professional or like an expert on something, we should maybe, I'm not a lawmaker, so I don't know how we would implement this, but restrict how you can talk about these things. Like, for example, like as a personal trainer, it really used to stress me out where some buff guy who like got really fit then wants to give like fitness advice to like the general population, but without thinking about the biomechanics of the body and like how this could be like contextual to like each individual, blah blah blah. It really stressed me out. So even more important in like the medical arena, I wish that there was some way that we could restrict certain certain conversations to only experts or to people who have some sort of like expertise. Going back to what you said about the human component, like social media and social platforms are very much hinged in a way on virality, right? And people are optimizing for like virality or like clicks and engagement. So of course, any information that's a bit more controversial or like spicy, to use the term that I used before, is going to attract more attention, attract more engagement, attract more reshares and shares, and it kind of creates a ripple effect. So I think these platforms by default are optimized for virality. I don't know that they're optimized for false information spread. So I'm less concerned with how they're optimized for false information spread. I'm more concerned with empowering experts and getting more people with expertise to talk about the topics that they know. I use the Andrew Huberman example again. For example, I mean, he has one of the most popular podcasts, I think, if I'm not mistaken, on Apple Podcasts. On social media, he's very popular and like people in that space, right? So relatively like new-ish thing, but I think it's happening. Like real information, quality information, medical advice is spreading.
So maybe to sum it up, we have like two reasons why it works so good. Like we have the technical
Mm-hmm.
side of the answer.
Mm-hmm.
So
Mm-hmm.
platforms are designed like that. The content producers are, so to say, designed to do that.
Yeah.
And they get trained to it more and more if they reach more and more people.
Mm-hmm.
And like the personal or patient side of the whole story is that you would like to feel heard.
Yeah.
You would like to belong to something, and of
Mm-hmm.
course also sensation seeking.
Like you will engage with something that seems a bit controversial or something that really resonates with you, one or the other.
What advice would we give to the people outside how to find out or how to distinguish between truth or myth? I mean, yeah, on the one
Yeah.
side is to do not do social media for example, health things,
Yeah.
or just try to find the best sources. But I think it's not that easy. So we
Yeah.
maybe also can give an advice how to find out. I mean, we have also AI nowadays, so maybe there's also a good way to use AI for that, actually. So what would you say?
I mean,
How to-
one is always get a source. Like, so just to start with what you mentioned about like using AI, like whenever you get information, like try to figure out the origination point of said information, like what is the source, number one. Once you find the source, do your best to verify the source, right? So is it a trusted platform? Is it a layman who is talking, or is it someone with a medical license or uh, some sort of like healthcare professional who's giving this advice or this context or this information? So yeah, always using finding the source or like drilling down to the source of information and doing your best to verify this source. um this is a little bit more niche advice, but I love reading peer-reviewed studies. I'm one of these, like, I was one of those early adopters of like the Andrew Huberman movement, and like always loved the way that science is presented to a non-scientist like myself, to a layman. So like listening to that kind of information, and then I would literally, he linked in his podcast. I'm talking so much about him. I feel like you should give us free promotion or something. He links a lot of his sources, right, from like where he sources for content that he pushes through his platforms, right? So sometimes I used to like go and literally like read them, the ones that were publicly available. I know that this is not practical for everyone to do, but yeah.
No, I think it's a good advice. So I think tips and tricks would be just to always double check the source, try to get to know where the information comes from. And I think also in times of AI, you can just like take the source and put it into AI and say, please use it, explain it to me in patient-friendly words without changing the content itself, for example. So I think it's nowadays easy to get the right information. It's just about, no, it's not easy because there is a lot of information, but it's just about how to get them. So you
Yeah.
have to use, of course, the correct prompt. You have to prompt the AI to not change the content, to just change the wording. You have to tell the AI to give for every statement, health statement, a source, and then click there and check if the source is really valid. So to say. I think there are many ways, or I think people just have to build those patterns to get this
Yeah.
information. Not trust the first source as it is.
You mean
How-
not trust the first source as
Yeah,
it is? Yeah.
yeah. Sorry. And maybe also regarding the point who to trust, I think this is very tricky also, to be honest, nowadays, because there was a big case right now with a German influencer, I would say med influencer, who is a doctor, I think, right now, and promotes sometimes, of course, conditions or treatments. And there was now a trap from another YouTuber who sent over a collaboration request for a made-up disease, which was like with some symptoms were true, some not, and the condition itself were completely made up for money, for a collaboration
Yeah.
on Instagram. And
What?
she agreed on it, and she talked about, as a doctor, you know, with this medfluencer background, or
Spicy.
even as a medicine student, you have trust for the people. I didn't want to bring up because I think everyone is on this topic right now, and I think she suffers a lot. So it's I do not want to blame her because everyone can make mistakes, but I think nowadays many people really losing their trust because of job titles, or I don't know. So this was
Yeah.
crazy. Yeah. So also with this, you can't even trust if a medical doctor tells you something.
I
You
think
know,
it's back to what I was saying before. Like, I think it's honestly, it's our macro environment as a whole. I don't mean to sound like a downer. I think this whole idea of like social media and optimizing for virality and engagement, and sometimes people will compromise their stands and like their license. It sounds like maybe in this case for money or popularity or whatever else. Yeah, I think it's the symptom of our environment as a whole.
I think it's always about finding the correct information, try to validate them
Mm-hmm.
on your own. I think this is a superpower everyone should have.
Mm-hmm.
I
Mm-hmm.
think we just pointed out some good ideas and some good ways to do that,
Yeah,
actually.
yeah. I think it's a good segue. For example, like this is one of the things that makes me really excited about building Brite and like building our app. All of the content that we surface in our app and in our product are created with a real medical team, of which you had, Lisa. All right, so it's really trusted content, trusted education. I think the part that I feel more passionate about is building products with trusted sources. Right. So not just like generic tools out there or just like generic AI models and or generic anything, social media, going to platforms, products, apps, applications, apps and applications, platforms that are built with from trusted sources, right? Like co-created with real medical teams and validated. We're also not optimizing for engagement or like monthly active users. It's a good metric to follow. This is one of the unique things about building product in healthcare, and I'm learning as I go, especially coming from a different background. I have to change my perspective. The thing that I started telling myself is that these are patients, these are not just users. And so even just like changing how I view who our users are, I mean, they are users, is also like influencing like how I think about product development, how I'm driving the team, how whatever else. These are real patients with sometimes life and death situations.
I think we have already the topic for the next episode then. I would really like to hear about how to build an app for patients, to be honest, and what is different to users or to fitness app maybe. So this is interesting. Let's keep in mind for the next time.
Yeah.
Have you actually had a patient make a real decision about their health based on something they saw online?
Yeah, of course, every day, all the time. I think this is like really common because, as we said, you would like to feel heard, understand. You would like to belong to a group, to a crowd, so to say. And many patients come to me with like printed files from the internet, or also like with their phones with ChatGPT. I think this is totally normal and understandable.
How dangerous you think it can be?
Of course it's dangerous, as we said. So if people are not reflecting what they're reading, then it's super dangerous. I think there was also a case where a man got poisoned because AI said to take, I don't know what it was, to eat something actually, and it was a poison at the end. So he went to the hospital. He did not die, I think, but it is dangerous. You always have to think about it on your own and find out what is true and what not. And I think we gave some good tips how to deal with it.
Is there like a version of social media that actually helps people with their health, or is it all working against us?
No, I definitely do not think that social media is all working against us. I think, unfortunately, the burden is now on each individual, right, to like understand where their information is coming from, cross-reference this information, review it, make sure that it's from a trusted source, etc. I mean, social media, at the end of the day, even when I talked about like being optimized for virality, etc., it goes both ways, right? So for false information, but also for true information. Maybe it's true that false information carries faster and is more exciting, and so it's more likely to be engaged with. But I definitely think that the same carries over for real information and like true medical advice if you seek it out. So instead of blaming it on social media only, unfortunately, I will put the burden on the individual who's consuming social media and the content from social media to make sure that they trust your sources and cross-reference your sources.
Yeah, I agree with that, actually.
What do you wish people would do before they believe the next health thing they scroll past?
I think at first it's good that people take care of their health. I think this is also something we have to state here. So it's good that there are information that are interesting for people, and I think they should not be believed like for the first second. you should really go to the internet and search for reliable sources to trust from the government maybe, or from patient organizations. Like, these are typical sources you can mostly trust.
Why do you think people will trust a stranger on the internet over a doctor they have actually met?
It's a really good question. I think it boils down to what Lisa said before. People want to feel a sense of community. People resonate with things that feel or addressing their unique situation, or like where they are in particular. And even if someone is, spitting bullshit, if you feel like I've had a similar experience to this, right? Confirmation bias, right? I think this is just like a typical human behavior. You might want to engage more with that because you feel like it explains to you in one way or the other. So that's on one hand. I think on the other hand, there's a lot of distrust with healthcare professionals, especially with like doctors, because sometimes they think that they are trying to get you on more medication. For example, this is like in the US, maybe they're partnered with a pharma company, and they're trying to get you on their products, for like ulterior motives, which is obviously not the case. And I'm glad that I'm saying this with a real medical doctor on the platform. But from a patient's perspective, it can feel like this. Maybe more important is sometimes people feel that the doctor doesn't understand their very individualized, specific situation, and that can be hard, right? So sometimes the advice can feel generic. It feels like, also, like, doctors are very busy. Let's be very clear about this. So they're also doing a job, and so it's sometimes it's a hard problem. So people don't feel like they're getting as much individualized care in the context of their very specific situation, which might make them trust a stranger more. I have to say this again to plug Brite because I'm just so excited about what we're building. But one of the value propositions, I would say, of our product is what happens in between doctor visits is sort of out there in thin air. Like, no one really knows. And what we are doing as a solution to this problem is using data to explain what happened in between doctor visits. How did you adhere to your medication? What were your lifestyle and behavior within like those the time period between like doctor visits? How can we help your doctor get more context about your specific situation in a short amount of time in a digestible way to allow your healthcare professional, give you better and more individualized care, but also to help the patient trust more the advice that they get from the doctor. So it's a two-way street.
Thank you. This was a really nice episode. Thank you, Confidence, for
Thank
joining
you.
again. I'm looking forward. We already have the next topic. So how to build
Exactly.
a healthcare app.
Yeah,
And what
I
is the
cannot
difference
wait.
between patients and users. I cannot wait because I can only learn from that, to be honest. And also thank you everyone who is listening to us, who's watching us. And we are looking forward to next week. And we really hope that you will join us as well next time.
Thanks for having me. Tschüss.